Welcome to Complete Mind and Body, where we aim to enlighten the mind, body, and spirit through the power of holistic living. I'm Christine Lucas. On today's show, we have a very special guest. This is someone whose work has had the most influence on my life and in my personal nutrition counseling practice. I'm thrilled and honored to have with us today the director of the Hippocrates Health Institute, Dr. Brian Clement. The Hippocrates Institute is respected as the leader in the field of natural and complementary healthcare and education. It's an incredible place where individuals go to learn how to claim their health and vitality back. Its lush tropical setting in West Palm Beach helps guests to connect to nature and to themselves while receiving top-notch education on health, nutrition, and alternative healing therapies. For decades, Hippocrates Health Institute has helped hundreds of thousands of people to heal from life-threatening illnesses. Their life-changing programs advocate a living food, enzyme-rich diet, along with exercise, non-invasive therapies, and positive thinking to restore balance and health to the body. So welcome, Dr. Clement. Thank you so much for coming on the show. It's such an honor to have you with us today.
Thank you for having me.
So can you tell us a little bit about your life transformation programs at Hippocrates Institute and what one can expect when they stay with you?
Well, as you know, we opened our doors in Boston, Massachusetts about 55 years ago. And it was because our founder recovered from stage 4 colon cancer that the Harvard doctors basically gave her 3 to 6 months to live with. And ever since then, people from all over the world have come through our program. And her mission statement, we've carried that light. Help people to help themselves. Not heal people, not cure people, not sell people a sales pitch, but to educate people. Because knowledge is the most powerful healer. And so when people come to us through our life transformation program or our health education program, which then they go out and teach this worldwide, they go through consistent education, 35 to 45 hours a week. But it's fun and it's practical. We take them from basic anatomy, making it fun. You know, many people don't know where the organs in their body are.
That's true.
And it's exciting for them. And it's not boring in the science we learned in school. And we actually get them in our vans and we bring them to an excellent health store and show them 85% of what's here is not good for you. And so when they leave, they know what to do for the rest of their life.
And that's at a health food store.
Absolutely. And so we really make this practical. Now, what we're best known for globally is people coming to us and healing disease. Cancer right at the top of the list. But the lesser diseases, cardiovascular, diabetic, multiple sclerosis, Parkinson's, Lou Gehrig's disease, right down to the easy ones, chronic fatigue syndrome, fibromyalgia, etc. This is what we do every day.
I heard you one time say that you're either enlightened or frightened
That's right.
into the living foods, and
That's
that's always stuck with me. So what are some of the benefits that cancer patients that have come to you have received?
Well, cancer patients or anyone else, our foremost objective is to get their bodies to function. And the part of their body that functions in preventing and eliminating cancer is the immune system. Tonight, right here, we're going to be doing a conference on that and it's showing the immune system and how wondrous it is. It's just extraordinary. When you just know the basics of this, you understand that there's a universal plan for all of us. And if you just nourish it and you love it and you take care of it and you sleep adequately, it wants to fight for you.
That's right.
But what do we do in our cultures today? Worldwide, we almost have a full-time job to destroy our health and our immunity. So when that immune system builds up, no matter what the disease is, because all disease, in our opinion, is systemic disease.
Right.
It's not a categorized disease. Where is it? Where is the cancer in your body? And the immune system then happily begins to fight that and erode the tumors, erode the disease, erode the leukemia, whatever it may be.
So what about when it comes to screening? I think most people rely on radiology or invasive procedures, which can't they make the cancer worse?
Well, they can, but you know, the one area that does shine in allopathic medicine is diagnosis. The treatment protocol for cancer is horrible, but the diagnosis is good. And let's preface it by saying that we are absolutely clear now how CAT scans and even mammograms enhance the potential for cancer. And so you are right. But today it's the best, it's the most available. There's an emerging science that's coming together, thermography, which we're very happy about. That's non-invasive, that looks at heat and determines whether or not you may potentially have a cancer. Other forms are coming out, an AMAS test that mainstream physicians put together that's not invasive.
And what is your opinion on PET scans?
Well, PET scans are the best that's ever come down the pipeline for us. And PET scans really confirmed what we discovered 30 years ago, that sugars of all type literally feed cancer. And let's expand that to other diseases, viruses, bacteria, mold, yeast. And they inject sugar into the body, and when the cancer goes to eat it, it glows. And not only does it glow, but wherever it's moving to or metastasizing to, you'll actually pick that up on the PET scan. Now the problem is, after a short time, they started to insist that they put radiation in with it.
That's what I've read about that.
So
I didn't know it was sugar. So it is sugar.
It's sugar
now
initially.
It's radioactive.
Unfortunately, the sugar would be adequate. But you know, when the politics get involved and the economics get involved.
Sugar's cheaper. They can't make as much money on that one.
That's right. And the other thing is that we've actually had colleagues of ours extract fructose from organic apple juice and use it, and it worked just as effectively as white sugar.
Wow. So what about Coumadin? I'm sure a lot of people come to you who are on Coumadin, and it seems like just the food that we're teaching people to eat to heal their bodies is what they're not allowed to eat when they're on this medication. So how can you get them off of this medication so that they can start to heal their body naturally?
Well, it's a vicious cycle, to be candid with you. Why people seemingly require anticoagulants is they're eating meat, they're eating dairy food, they're eating non-nutritive food, flour products, you know, breads, pastas, whatever it may be. And so they've thickened their blood. Now, ironically, if they ate properly, 99% of them would never ever need an anticoagulant. The 1% that may are the people who have pacemakers. And that's it. Everyone else would be out of that picture. So the ironic thing is, when you have clogged up your system and you go on an anticoagulant, Coumadin's only one of the brands, Lipitor, and a whole list worldwide, different names. You literally, then getting on a good diet, put yourself in a very ominous position. Because if you further dilute your blood with the medicine, when nature and lifestyle has diluted your blood, you could have a stroke. So be very cautious about that. Get with your physician and demand that he or she literally reduce the Coumadin or Lipitor, the anticoagulant, as you're improving your lifestyle. And this happens very rapidly. We're not talking about months or years, we're talking about days and weeks.
Days, absolutely.